I am Dr. Mailis, and today we'll break down nerve pain, what causes it, how it feels, and what treatments can truly help. Nerve pain, or neuropathic pain, happens when the nervous system itself is damaged or starts misfiring. It can involve the brain, the spinal cord, or the peripheral nerves that travel through your arms, legs, and skin. When a nerve is injured, it can act like a frayed electrical wire, sending sparks and signals when it shouldn't. That's why even a light touch, clothing, or a gentle breeze can feel painful. Sometimes people also notice numbness, weakness, or strange sensations in the same area. People often describe nerve pain as burning, electric, or tingling, sensations that can spread beyond the original injury because the nervous system becomes overly sensitive, like an alarm that won't switch off. Neuropathic pain can appear in many different ways, depending on where the problem is. Sometimes it is in the brain, sometimes the spinal cord, and other times in the smaller nerves that reach out to our skin and muscles. After a stroke, when part of the brain loses blood flow, some nerve cells die and others misfire. Albert, for example, developed constant burning pain in the paralyzed side of his body. Even gentle touch felt unbearable. This condition is called post-stroke central pain, and it's one of the most challenging to treat. Peripheral nerves, on the other hand, the ones that connect the spinal cord to the rest of the body, can also be affected. Maria, for instance, lived with diabetes for many years. Over time, high blood sugar damaged the nerves in her feet. She described it as walking on fire, with numbness mixed with sharp, stinging pain, a condition known as diabetic neuropathy. Charles injured his lower back lifting a heavy gardening pot. A herniated disc pressed on a spinal nerve, sending sharp pain down his leg, a classic case of sciatic nerve pain. Finally, some people like Esther, who developed nerve pain after shingles, experience pain long after the injury heals. She felt a deep burning sensation under the skin that made even a light breeze hurt. That long-lasting pain is called post-herpetic neuralgia. These stories show how neuropathic pain can arise from the brain, the spinal cord, or the peripheral nerves. But in every case, the core issue is the same: abnormal nerve signaling. When those signals go off track, the nervous system can create pain even when no tissue injury is present. While there is no single cure for neuropathic pain, there are many effective ways to control it and improve life. Let's start with medications. Ordinary painkillers like ibuprofen don't work because nerve pain is not caused by inflammation. Instead, we use medications that calm irritated nerves. Antidepressants such as amitriptyline or duloxetine, or anti-seizure drugs like gabapentin or pregabalin, which all help to reduce overactive nerve firing. In some severe cases, opioids may be used under close medical supervision. There are also topical treatments, which are creams or patches applied directly to the painful area. They calm the nerves right where they are firing. Examples include lidocaine patches, capsaicin cream, or specially made creams by compounding pharmacies to target nerve pain more precisely at the site it hurts. For some people, medical cannabis in sprays or capsules can also help under a doctor's guidance. But medication are only part of the picture. Non-drug therapies play a vital role too. For example, physical therapy helps keep the body moving and retrains the nervous system through gentle exercises and desensitization techniques. A TENS machine would use mild electrical impulses on the skin to interrupt pain signal. In more severe cases, however, targeted injections or spinal cord stimulators may be used to control persistent nerve pain. And finally, we can't forget the mind-body connection. Psychological therapies like cognitive behavioral therapy or training in mindfulness techniques can ease the emotional stress that often makes pain worse. When we treat both the body and the mind, results are always better. Neuropathic pain can have many causes. Sometimes it happens because nervous tissues are damaged or malfunctioning, and other times because they become irritated after an injury or illness. It can feel like burning shocks or tingling. Ordinary painkillers don't work, but nerve-specific medications, physical movement, and emotional support can make a big difference. And most importantly, managing neuropathic pain takes time, patience, and a whole person approach. If you found this episode helpful, give it a thumbs up, share it, and subscribe to the Pain and Wellness Health channel for more real stories and science you can use. See you in the next episode.